Hello and welcome. Today we're going to be administering 4 medications for Mr. Jones, Cyrus Jones, 64-year-old male, admitted with uncontrolled diabetes, has a history of hypertension, atrial fibrillation, and glaucoma. Alright, so we have a medication administration record here, the physician's orders. I'm just already going to note the allergies written in red, but let's just cross-reference these two documents. So we have Cyrus Jones, same birthday, same PIN numbers for each. Alright. Okay, and we'll just double check these two are the same. So we have acetaminophen 500 milligrams PO BID, acetaminophen 500 milligrams PO BID, and then we have warfarin 20 milligrams PO once daily OD, warfarin 20 milligrams PO OD, and then metformin 50 milligrams PO BID, it's the same, and then timolol 0.5% ophthalmic solution, 1 drop to right eye and 2 drops to left eye BID. Those two are the same. And we'll just take a look at the medications here. So acetaminophen, we have, so these are 250 milligram tablets. We need 500, so we have 2 tabs. Cyrus Jones, birthday, Finn, physician, PO, expiry is alright. So we got for next year. So that's good. That cross-reference with both of these. Next we'll look at warfarin. So we have 20 milligrams, so we have 10 milligrams tab in the bottle. So we need 2 tabs. Cyrus Jones, birthday, Finn, same physician, PO, expiry 2022. So that's good. Then we have metformin 50 milligrams, so it'll be 50 milligrams here, 1 tablet. Cyrus Jones, birthday, Finn, physician, PO, expiry 2022. And then finally we have our ophthalmic solution here, the eye drops, timolol 0.5%. For Cyrus Jones, Finn is correct, physician, root, ophthalmic, expiration 2022. Alright, so let's talk towards acetaminophen first. Actually, you want to wash your hands. I'll just wash my hands here for handling medication. Sanitize. And we'll just talk towards acetaminophen. It's an analgesic, antipyretic, so it blocks peripheral pain impulses as well as inhibits prostaglandins in the central nervous system. This is for pain and fever regulation. The dose here we're giving today is within the normal limits and under the toxic amount. The adverse reactions to look for rash, urticaria, nausea, vomiting, abdominal pain, renal failure, and then we have contraindications, so hepatic renal failure or disease, each, and any interactions. So we have alcohol, you gotta watch out alcohol consumption, as well as warfarin, which we are giving today, so I'll just make note of that. This can affect the liver enzymes along with warfarin, so you want to watch hepatic liver production, and that's part of our nursing implications, along with renal assessment, CBC, prothrombin time, input output, and then as well as that fever and pain. Just want to make sure we're within therapeutic range and it's working. So I'll just, so it's 250 milligrams per tab, And we're going to need 500 milligrams. So 2 tabs. And I got label made up here. Just like that. And then next we'll talk towards warfarin. With warfarin, it's an anticoagulant, and its action is it interferes indirectly with blood clotting. So it does that by depressing the hepatic synthesis of vitamin K being a coagulation factor. The reason for warfarin would be for prophylaxis and or treatment of afibrillation, and it's used against systemic embolisms. So that's what we'll be giving for Mr. Jones today. And its dose is in with therapeutic range, under the toxicity, as well as noting it can be titrated according to the INR and prothrombin time. So got that today. And as well as adverse effects to look out for include dizziness, fatigue, headaches, lethargy, chest pain, edema, dermatitis, nausea, vomiting, uncontrolled bleeding, hepatitis, with jaundice indicating that. Contraindications include pregnancy, hypersensitivity to the medication, bleeding, as well as ulcers, severe hepatic disease, and malignant hypertension. Interactions include INR results, the increased risk of bleeding and blood clotting, as well as chronic liver disease again. Nursing implications include CBC analysis to check on INR ratio and prothrombin time, and just to watch for bleeding with fever, skin rash, urticaria. So today we got for warfarin 20 milligrams. So these are 10 milligram tabs. We need 2 there. As well as the tag and label for that medication. Okay, and then we'll talk towards metformin. So with metformin, it's an anti-diabetic, and it inhibits the hepatic glucose production as well as increasing the sensitivity to insulin, mainly in peripheral tissues. The reason for this medication, it can be used by itself or in combination with other anti-diabetics to control hyperglycemia within stable patients, so patients with good level of consciousness, and also with type 2 diabetes mellitus. The dose today is within therapeutic range and under the toxicity. Adverse effects to look out for include tinnitus, fatigue, vertigo, rash, decreased B12, so watch for the decrease in energy, as well as heartburn, anorexia, and acquiring a metallic taste. Contraindications include severe renal disease or dysfunction or failure, as well as excessive acidosis in the body, including diabetic ketoacidosis. And watch for alcohol intake, severe hepatic disease, severe infection, recent surgery, and if you're pregnant or breastfeeding, which you shouldn't have to worry about for Mr. Jones today. As well as any interactions, we'll look for increased hyperglycemia with certain meds, like calcium channel blockers or corticosteroids. And nursing implications will include assessing hyperglycemic and hypoglycemic reactions, as well as teaching the patient to self-monitor their blood glucose levels. And we will continue to do complete blood count to see if there's any blood changes indicating kidney failure or therapeutic response is is within range. So for this, we have 50 milligram tabs, so we just need the one today, as well as the label for that. And then finally we have Timolol. So with Timolol, it's an anti-glaucoma. It reduces aqueous humor as well as increases the outflows in the oculus. The reason for this is to treat any chronic open-angle glaucoma, ocular hypertension, or cephalic patients with glaucoma. So today the dose is within normal. Sorry, the dose is as indicated, 1 per eye, but in this case we are giving 2 drops to the left eye for Mr. Jones. And adverse effects to look out for include depression, headaches, nightmares, eye stinging, tearing, visual disturbances, palpitations, and dry mouth. Contraindications include hypersensitive to this product or any other beta blockers, as well as if you have asthma, COPD, bronchospasms, or for children and infants, it's not recommended. If you're bradycardia, if you have cardiac problems, or if you have cardiac failure as well as cardiogenic shock, this medication is not indicated. Interactions include increased beta blocking, an increase internal ocular pressure reduction, so relieving pressure in the eye, as well as increased blood pressure, increased depression of AV nodal conduction, increase AV block nodal conduction, as well as increase anti-hypertension effect. So the implications, nursing implications for this medication include monitoring the IOP, the internal ocular pressure, for a glaucoma therapeutic response. We don't transfer this to another medication, but we will need gloves for administering, and cotton balls, cotton for any excessive fluid. And we'll just include, we got our water here. All right. Excuse me. All right, so now that we got all our medications set up, I'm just going to cross-reference my labels, medication labels here, to the medication bottle, as well as these documents. So we have Cyrus Jones, Fin, acetaminophen, PO 500 milligrams BID at 1000 hours. All right, so I got this label ready and verified it. And I'll just initial it there. Well, next we'll move on to warfarin. So again, we're just cross-referencing these. Cyrus Jones, the Fin, warfarin, 20 milligrams PO once daily at 1000 hours. Okay, so that checks out with the time here, the medication. So I can just initial that, indicating that medication is ready. And then we'll check the metformin. So again, just checking all the labels with the documents. Cyrus Jones, the Fin is correct. Metformin, 50 milligrams PO BID, 1000 hours. And that checks out with the time here. So I can initial that one. And it is ready. As well as the eye solution here. So we have Timolol, Cyrus Jones, birth date, physician, route, ophthalmic, and then we have the at 1000 hours and 2200 hours. So we'll be giving the 1000 hours 2 drops left eye, 1 drop right eye. Let's initial that. There. So that's our second check, and now we can head to the patient's room. Let's include my water. Okay, and then before we leave, we just got to put these medications that we're not done with, or we're all done with, back in storage. So those would go back in storage, just not to leave them unattended or anything like that. And we've already noted the drug allergy for morphine. We'll just double check that with the patient. Okay. Hello, Mr. Jones. How's it going today? I'm Morgan from University of Manitoba student, year 2. And we're just going to be administering your medications today. Could you tell me your birth date? April 19th, 1954. Yep, that's right. I just want to double check that. So as I came in, I checked the room, assessed the floor for any safety precautions, concerns. Next, we'll just check the patient's wristband. I would check the patient's wristband to confirm that that is their name and that the fin is correct, the birth date and such. So let's get out medication administration here. All right. Okay, and we'll just do our last check. Okay, so got your water here. And these. So today we're gonna, I'm just gonna explain to Mr. Jones what medications we're gonna give him, and explain the reasons for, like, what we're gonna give him and what to look out for. Hello, Mr. Jones. So today we're gonna give you acetaminophen. It's for your pain and fever. Things you want to look out for is just a rash or urticaria, which is also just part of your skin, and then as well as nausea, vomiting, abdominal pain, or renal failure. All right, so just want to mainly check on that fever and pain, make sure the medication is working. Next we'll have warfarin. So today, Mr. Jones, your warfarin's gonna it's used for your history of atrial fibrillation to prevent it, or prevent future episodes from happening. Just some adverse effects to look out for this medication include dizziness, fatigue, headaches, lethargy, chest pain, edema, dermatitis, nausea, vomiting, uncontrolled hemorrhaging, as well as looking out for jaundice indicating hepatic failure. Okay, so we'll have that. And then your third oral medication today will be metformin. With metformin, we're using it to help with your diabetes. It's to control your blood glucose levels and make sure you don't become hyperglycemic. Adverse effects to look out for include tinnitus, fatigue, vertigo, rash, decreased B12 levels, so decrease in energy if you feel lethargy, as well as heartburn, anorexia, or you can acquire a metallic taste. All right, so we'll just keep an eye on your hypoglycemic and hyperglycemic reactions, as well as I just want to emphasize how important it is for you to self monitor your glucose levels, so you just get a hang on those things if any effects come up. And then we have eye drops for you today as well. So for your eye drops, this will help with your glaucoma, and it'll increase the outflows, so it'll decrease the pressure, your internal ocular pressure within the eye. Adverse effects to look out for include depression, headaches, nightmares, eye stinging, tearing, visual disturbances, palpitations, or dry mouth. And so we'll just monitor your IOP, your internal ocular pressure, and just see it's providing therapeutic response for your glaucoma today. All right. So so I'll just I would assist the patient and get them to sit at a high Fowler's position, almost upright, and heighten the bed there for oral medications. Depending on the patient, if they're used to medications or not, you can just hand them one at a time, 1 cup at a time with the water, whatever they need, whatever comfortable for them. After administering the medications, you just want to make sure that the patient did in fact swallow the medications, they're not choking on them or holding them within their mouth. And then, as well as, so for the eye drops, I would wash my hands again upon entering the room, and then once more in between the oral medications and the eye drop administration, as well as donning gloves to prevent any cross-contamination. All right, Mr. Jones, I'm just going to do your eye drops today. So you got 2 drops going into your left eye and 1 drop going into your right eye. All right. So I would just give it 1 eye at a time. Got your cotton ready for the excess. You could hold the conjunctiva, the bottom of the eyelid, down. Rest the hand on the patient's forehead as their head is leaning back. Drop 2 into the left eye and just get them to move their eye around and make sure it's getting spread, as well as putting pressure on the bridge of the nose to cut off the lacrimal duct to prevent any solution draining down into the oral cavity, nasal cavity, and into this into your body system, causing a systemic, and then you'll lose the effectiveness of your drug. So you just want to make sure you're holding the lacrimal duct, bridge of the nose, for 1 to 2 minutes, and if there's any excess solution, you can dab the eye. Just make sure it doesn't go down their face. And then, so same thing for the right eye. You would have it, pull the bottom of the eyelid down, head back, administer 1 drop, hold the bridge of the nose, use the cotton for excess, and you can hold the bridge of the nose for 1 to 2 minutes to prevent the solution from entering your system. So after that, it's all administered. All the orals are administered. The eye drops are administered. Gloves are done. I just forgot my pen. Okay. So here we'd have today's date. As well as my initials for the acetaminophen that we administered at 10 o'clock. The warfarin that we also administered at 10 o'clock. Metformin we administered at 10 o'clock. Initial there. And the Tamol drops. So we got 1 to the right, 2 to the left. 10 o'clock. All those are done. Alright. We can gather our things here. And so yeah, you just want to remind the patient that to watch out for any adverse effects, to make sure they call for help whenever they need. And we can lower the bed back down to a low Fowler's position or whatever position they find comfortable. And then just want to make sure their call bells, if they had a call bell, it would be reachable for the patient. And that's everything. Thank you, Mr. Jones. We'll come check on you in a bit, and we have more medications for you this evening. All right. Thank you. Have a good day.